Welcome back, everybody. Welcome to another episode of Elite Medical School. I'm joined by co-hosts Dr. I and Dr. PhD.
Hello.
How are both of you this evening?
I'm feeling shallow and pedantic.
Both shallow and pedantic.
Yes.
I'm feeling deep and semantic.
Nice. My urethra is burning, so I wanted to talk a little bit about that, if you guys don't mind. So jumping right into things, today we're going to have an elucidating discussion of urinary tract infection, a both common and somewhat serious ailment that afflicts both genders and can be an end-stage process, especially in men. So, in terms of epidemiology, women are hammered by UTI. On the order of 10% of women will have recurrent UTI, which is defined as greater than 3 per year, and that's relevant for prophylaxis eligibility. Does anyone want to discuss some risk factors for getting a dirty pee tube and bladder?
Well, as you said, being female is definitely a big one due to the shortened distance between the anus and the urethra in them.
The anus. Also known as the anus. Yep, that's right. So proximity is an important feature there. Okay.
I think certain wiping habits also in females have been associated with higher risk of UTI.
Hygiene, absolutely. So when you see the pleasant 50-year-old dignified woman, the first thing you want to do when she comes in with a UTI is start demonstrating proper hygiene. You say, lady, you've been doing it all wrong. This is how you wipe your puss. You wipe from front to back. Don't get the poo-poo in the veg. So anyway, that usually goes over quite well and is well received. But
especially in that tone.
Yeah.
Yeah, good.
You cleaning your snatch all wrong, lady. But yeah, so hygiene, important feature.
What about peeing after intercourse?
Mixed reviews. I mean, normally when I'm done busting, sometimes I will move on to a golden shower, but typically not. With relation to urinary tract infection.
Yeah, no shit.
Okay. As I recall, there's poor evidence for that, believe it or not. But I still recommend it. But I don't think the evidence is great. Definitely, sex is an important risk factor, and you'll see it all the time anecdotally, especially in younger women, that sex is the trigger for subsequent UTI. And again, that will come up in our discussion around prophylaxis.
Yeah, other kind of risk factors that I'd try to think about are, especially in the hospital, foreign body is a big one. Prolonged Foley catheters or any kind of like instrumentation that goes into the urethra or bladder, all of those are going to be associated with higher risk of UTI.
Definitely, such as indwelling catheter. A few other items, more relevant to the younger population, and pyelonephritis specifically, which can be treated separately, but is relevant here as well. That is kidney infection. So vesicoureteral reflux, which is usually related to incompetent urethral valves, that can cause a refluxing of urine and subsequent UTI. So consider anatomic abnormalities and relatedly, BPH, that is prostatic hypertrophy, just by virtue of incomplete void and therefore stagnant urine. That is a lovely culture medium for E. coli to fester.
Similarly, diabetes. Diabetes patients are going to be prone to UTIs because of all that delicious sugar in their pee. The bacteria love that.
So
yes. Yummy.
Yeah, and on that line, SGLT2 inhibitors that make you pee out more glucose are also going to put you at higher risk of UTI.
Yes. Okay. So that is just fantastic. Why don't we talk a little bit about microbiology and the causative organisms, the culprit organisms for urinary tract infection? Does anyone have a useful mnemonic? This is sort of a read my mind type of question.
Is it keeps?
Yeah.
Is that what you're looking for?
Yeah. Yes. Do you want to elaborate?
Oh man, Klebsiella, E. coli, P is Proteus, and then I'm missing an E and an S.
Yeah. So Klebsiella, E. coli, Enterobacter, Proteus mirabilis, Pseudomonas, and Saprophyticus.
Saprophyticus. Yeah, definitely.
Yeah.
So that's great. E. coli, remember, definitely the most common cause, particularly in women because of the poo-poo and because they don't know how to wipe properly. I might start a public health campaign. Some people might accuse me of mansplaining, but I like just a YouTube pop-up like promoting front to back wiping. I think it might be well received. So E. coli, definitely the most common, maybe 80%. In men, you can see some of these weirder bugs not infrequently, such as Klebsiella and Proteus. Proteus is nitrogen fixing? Is that correct? So it causes anyway. We'll get back to that. And this is relevant in terms of antibacterial susceptibilities. So do consider your culture. According to local guidelines, we actually don't have to culture for uncomplicated UTI premenopausally, which is interesting. And I make use of that just in terms of resource management. But especially with recurrence or any men who develop UTI, definitely get that culture, which will be useful. And then be aware, related to that, commensal organisms, if you're seeing strep and staph, and look at colony forming units as well, that is density of growth, just, have some due skepticism. Also quite relevant to less than optimal catches. So optimally, we want a midstream, that is patient pees a wee little bit, and then you use the cup to collect that midstream urine. Therefore, the goal there is to reduce contamination by skin flora. So be skeptical when you see commensal skin flora in your culture, especially at low colony forming units.
So what kind of symptoms would we expect with something like a UTI?
The big one is going to be dysuria.
True. What is dysuria?
That's going to be a painful or burning sensation when they urinate or void.
Yeah. So very, very straightforward. It hurts a lot. And any other symptoms?
You're going to have increased frequency. You're going to be going to the washroom a lot. It's going to be like smaller volumes. You're going to have this feeling of like urgency, like you need to go all the time, much sooner than normally you typically would. There might also be some other things such as hesitancy or post-void dribbling. Can also see some actual like super pubic pain, so they actually have some discomfort around their bladder. And then other things I guess you could ask them is about whether there's any foul smelling urine or a different smell to their urine, or if there's any like hematuria that's present.
Yeah, that's right. And especially important to ask about like making sure that the pain is in the right area. So we're thinking urinary tract. So we also want to make sure we rule out things like vaginitis or prostatitis. So get a good idea of the quality of the pain. So